Welcome to this educational video on public health ethics and professional values, a vital foundation for guiding decisions that impact entire communities and ensuring justice, transparency, and trust in public health practice. Understanding public health ethics provides a structured way to think about what is right and wrong when protecting population health. Unlike clinical ethics, which centers on individual patients, public health ethics focuses on population level issues. It helps professionals make decisions that promote community well being while respecting individual rights and freedoms. What is public health ethics? As a field of study, public health ethics explores the values and principles that justify public health actions. As a field of practice, it involves applying these principles systematically to real world challenges, balancing science, stakeholder input, and ethics. At its core, public health ethics addresses questions like: how do we balance individual liberty with community safety? Who gets access to limited resources? What's the most ethical way to respond to a public health threat? Core values in public health ethics. The American Public Health Association identifies six core values in its Public Health Code of Ethics. Professionalism and trust. Public health depends on public trust. This means acting with competence, honesty, and integrity, and ensuring decisions are not unduly influenced by politics or profit. 2. Health and safety. Protecting people's health and safety is an ethical responsibility. Public health actions aim to reduce harm and promote well being. 3. Health justice and equity. Ethical public health must reduce health inequities and ensure that policies don't worsen disparities, especially among vulnerable populations. 4. Interdependence and solidarity. Our health is connected to each other, to animals, and to the environment. Ethical public health promotes positive relationships that support collective health. 5. Human rights and civil liberties. Public health must respect human rights and protect civil liberties, even while addressing collective risks. 6. Inclusivity and engagement. Decisions should include meaningful participation from affected communities, especially those who have been historically marginalized. Ethical frameworks for decision making. When public health interventions may limit individual rights, professionals use ethical frameworks to evaluate those actions. These include five key conditions. 1. Effectiveness. Will the intervention likely achieve its intended goal? 2. Proportionality. Do the public health benefits outweigh any moral or personal costs? 3. Necessity. Is this intervention the only or best option to achieve the goal? 4. Least infringement. Can we achieve our aim in a way that limits personal rights as little as possible? 5. Public justification. Have we clearly explained and justified the decision to those affected? Applying ethics in practice. Ethical considerations must be integrated into every stage of public health work. Let's look at a few examples. Surveillance ethics. While tracking disease spread is essential, it must be done in a way that respects privacy and promotes transparency. Screening programs. Programs for HIV or tuberculosis must weigh benefits like early detection against risks like stigma or violation of autonomy. Community engagement. Ethical public health listens. Communities must be involved in decisions about policies that affect their lives. Professional standards and accountability. Ethical practice isn't just about individuals, it also depends on institutions. Health departments must create a culture of ethics by encouraging transparency and accountability, supporting ethical decision making, building public trust through communication and inclusion. The Public Health Code of Ethics, supported by organizations like NACO and the Public Health Accreditation Board, outlines principles that guide institutions to act responsibly. Balancing individual rights and community well being. A central tension in public health is this: how do we protect the many while respecting the rights of each individual? During pandemics, for instance, we may need to implement mask mandates or vaccination requirements. Ethical frameworks help us decide when these restrictions are justified and how to implement them fairly. Conclusion. A call to ethical public health ethics is not a side note. It is central to effective, just and sustainable public health practice. By embracing core values like trust, equity, and engagement. And by applying ethical frameworks to real world challenges, we can promote health while honoring human dignity and rights. As new challenges arise, climate change, digital surveillance, global pandemics, public health must continue to evolve with a strong ethical foundation. Thank you for watching. Let's commit to ethical public health for everyone, everywhere.